Joining me now, someone who works closely with Medicare patients, President and CEO of JAG Physical Therapy, Dr. John Gallucci Jr. Dr. Gallucci, thank you so much for your time today. All right, let's start with the fact that Dr. Oz has no experience at a federal agency, but that certainly aligns with a large portion of President Trump's cabinet picks. Does that concern you as a physician?
As a provider of healthcare, I think to have a healthcare provider in CMS is probably one of the smartest moves that the American people could want and need today. We've seen cuts by bureaucratic process that are silly, and we're losing providers that are caring for American citizens each and every day. We have opportunities through the utilization of physical therapy and occupational therapy to reduce and save over $10 billion in annual Medicare costs for people with slips, falls prevention programs. So I think to have a provider, a healthcare, a medical doctor engaged at CMS is very opportunistic for the American people.
And do you think there's any indication that he will not be confirmed?
I think it would be a hard push for him not to be confirmed. His experiences, his knowledge, his research. This is an individual that truly understands healthcare. So I find it very difficult to believe that he would not pass the hearings and get affirmed.
And with Dr. Oz, presumably at the helm, do you think it's almost guaranteed that Americans will see some sort of changes to Medicare and Medicaid? And do you think there needs to be some changes?
As I said earlier, I think the biggest issue is the concept of people that are non-healthcare is to cut healthcare providers. American people need access to healthcare. American people need providers to be giving a provision of care. We've seen in the last 25 years a decrease of primary care physicians. We've seen a decrease of practicing providers in the physical therapy space. We need those providers back to take care of American citizens. And if you include Dr. Oz and the providers in research and let people understand how research could reduce cost by best practice, you will see a much better operating CMS.
And Doctor, there's some allegations, some accusations from Democrats that Dr. Oz may have underpaid Social Security and Medicare taxes by more than $400,000, roughly $440,000. If that's true, do you think he will go back and make that right?
I couldn't speak on that. I could only say that I find it hard to believe someone as present and out in the front of the market would ever make a mistake like that. I'm sure he's surrounded by accountants, so I doubt that's really an accurate statement. And if you will go back, I'm sure he's an individual that would make it right. I do not know Dr. Oz personally, but it just doesn't make sense. It might just be allegations being made up.
Yeah, so we'll certainly see what happens as we move forward. Dr. John Gallucci, thank you so much.
Thank you.